If you want to write to me in the United States Senate, we'll make your story and comment a part of this record as well. We'll hear from our witnesses here today, but we know that there's scores of others give us other information. If you want to write to me, I'll make sure that it's made a part of the record. And you were turned down for Medicaid because you owned some property, is that right?
Well, and they said that I wasn't going to be on chemotherapy for 6 months. But then I don't know. I have to have a bone scan because I've still got cancer in 5 lymph nodes.
Yeah, well, can you afford to pay those bills?
No, I can't afford it. I don't have any income at all.
You worried about that?
I sure am. It's hurting my chemotherapy.
Have your children been having any health problems?
Yes. My kids, they ain't too well. They've never been. Or my wife, she ain't either, so I don't know.
What kind of problems?
I don't know, different ones. My little girl, she's just sickly anyway.
Sick. Do you have any kind of health insurance at all?
No.
Well, you can't, as I understand it, you can't get the health care for your children who are sick. Well, as Congressman Perkins and I can tell you, there's no member of the Congress that has to worry about that. Because we've got ourselves a real good health insurance program that we're glad to provide for ourselves and the presidents of the United States and ex-presidents of the United States. So there's none of the members of Congress that have to worry very much about that. And any time that Carl Perkins and I go and talk to our members of colleagues about having any kind of health insurance program, they're talking about, well, they say we can't do that. We can't either afford it, or there'll be people that'll abuse it. Even though any time we have a little sniffle, we can go over to the dispensary over in the house and see a doctor like that and get our medical needs taken care of just as quickly. And if we go on out to Bethesda or Walter Reed Hospital that are run by the Navy and the Army, paid for, the doctors paid for by the taxpayers, we get our bills paid, stamped in full. And I think if it's good enough for the members of Congress, it ought to be good enough for the people of Kentucky and the rest of this country.